Good morning, everyone. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, author of A Life, a Finger, a Pee Up a Nose, a practical guide to baby and child first aid. Today, we are talking about breath holding spells in babies and children. Now, this can be incredibly scary to watch, but thankfully, in the majority of cases, this actually doesn't do your child any harm at all. So, what I'd love you to do before we get into it today is that if you could give me a thumbs up or a wave just to make sure that while we're live on now that you are hearing and seeing me well. And also we'll be pinning this to the baby to toddler page and also the CPR Kids page for you to watch later as well. The other thing too is that we give you this information because we want every parent and family to have good evidence-based information about paediatric health subjects. It's incredibly important to us. So please, if there's anybody who you think would benefit from knowing this information, please just tag them in the comments below, because the more people who know this good evidence-based information, the better it is. So let's get into it. What we're going to be doing today is we're going to be talking about what is a breath holding spell, the two different types of breath holding spells. Certainly there is actually a link between iron deficiency anemia and breath holding. So what does that mean? What you should do if your child does have a breath holding spell, and any questions that you have. I can't guarantee that I will be able to answer it, but I can certainly research and steer you in the right direction to find the answer. So any questions you have, please pop them in the comments below as well. That would be absolutely fantastic. So let's get started. First of all, what is a breath holding spell and who does it affect? Generally, this affects babies and toddlers around from the age of 6 months to around 4 to 6 years, depending on the literature that you're looking at. Some say 4 years, some say 6 years, so the consensus is around 4 to 6 years. Children do tend to grow out of this. Now, for the interests of today, I am talking about simple breath holding spells. There are some children who have complex issues that is something different. I'm not talking about that today. I am talking about simple breath holding spells. So if your child does have a complex medical condition that involves this, then you need to follow what your pediatrician, of course, the plan, because it will be probably different to what I'm talking about today. So I just wanted to clarify that. And of course, if you're unsure or something is different, you call 000 ambulance. So just putting that up there. And of course, if you're in a different country than Australia, you probably don't want to call 000. You will call ambulance on whatever country that you are in. So now back to what they are. So generally they affect babies and toddlers around 6 months to around 4 years. Generally, most kids who are going to have breath holding episodes will have had one before the age of 18 months. Of course, there are outliers, there are kids who do different things, but that's just generally what will happen. Around 5% of children will have a breath holding episode at some stage in their development around there. So that is certainly quite a few kids. It is quite common. Now, when do they happen? Generally, there's a trigger for breath holding spells. It might be that they've had a fright. It might be that they've hurt themselves, that they're injured. It may be that they have, started to cry or have a tantrum, that they're frustrated or they're angry, and that can trigger a breath holding spell. But it's very, very interesting that traditionally it was thought that this was a behavioural problem. The evidence shows that this isn't behavioural, that this is an involuntary reflex. What I mean by that is the child doesn't choose to hold their breath. The child, it just happens. It's involuntary. And so that's an important thing to notice, is that is what the literature says. So that's evidence-based, that it's about trying to avoid the triggers if you can. Now we'll get into what you can do later, but that's absolutely part of it. So it's important, certainly we've been posting, when we wrote a blog about this, and there were lots of comments on there just going, oh, well, just don't let the child do it. You can't do that. It's involuntary. The child doesn't choose. Children who actually choose to hold their breath, they will take a breath before they pass out. So what usually happens is children who have, real breath holding episodes, they will usually cry, they will stop breathing, they will turn either blue, so these are blue spells, or cyanotic spells, because there are two different types of breath holding episodes. So with the cyanotic spells, what will happen? They will stop breathing, they will turn a dusky blue colour. I've certainly looked after a few kids in the hospital who had breath holding spells, not because of the breath holding spells, but because something else was wrong with them. And one of them, for example, a child was unwell and we needed to do a blood test. And he didn't want to have a blood test. And I don't blame him because, he was little, he was scared. So as we went to do it, he breath held and he went navy blue. The parents were amazing. They said, nah, this happens about 10 times a week. Just stand back, just don't touch him, okay? And we just pretend like nothing has happened. And that also is part of what you do. They were amazing. It had happened so often for them that they knew exactly how to manage it. And so we just, pretend like nothing happened. We ended up doing the blood test, but it just was really quite extraordinary to see this child in front of us just turn navy blue. Yeah, quite extraordinary. So that's what happens when we have certainly the blue or the cyanotic spells. Some of the evidence actually says that this tends to happen after the child has a temper tantrum or something like that, or something is really, really frightening for a child, that they may have the blue episode. And it's interesting that around 85% of breath holding episodes are actually the blue kind. Some kids will have both, and some will have the other type, which is pale or pallid breath holding episodes. Now, some of the literature actually says that this tends to follow a painful or a frightening experience, so a little bit different to the tantrum or the anger or the frustration. But of course, there are kids who will just have pallid ones no matter what the trigger is. So what happens in these ones? The colour drains out of their face, okay? So they become pale. It doesn't matter what colour skin they have, it will be different to normal, okay? So their skin will change colour. They will become very, very pale in comparison. If your child has got very dark skin, you may notice the inside of their lips, certainly their nail beds, their eyes, their conjunctiva might become really, really pale. Their skin will be a lot more pale than usual. So that's what you'll see. Their heart rate slows down, they stop breathing, and they lose consciousness. And certainly they can also wet themselves as well. They will sometimes lose control of their bladder, and that is part of this. Now, the episodes are usually brief, and of course, same with the blue episodes too, your child will lose consciousness, so they will become unconscious. So what do we need to do? First of all, we need to stay calm. These episodes usually self-resolve in under 3 minutes, okay? And that's really important. If it's the first time, you don't need to diagnose breath holding episodes. If it's the first time that this has happened, of course you're going to call an ambulance. If your child is blue and stopped breathing and this has never happened before and they're unconscious or pale and unconscious, of course you are. But if this is something that your child has been, diagnosed with, there are a few things, or it's happening repeatedly, there are a few things that we are going to do. So now, if you're wondering why I keep looking down, it's because I have my journal articles here, my literature, and also some of the questions that you have been asking us over the past week. I don't want to miss any of the questions that you've asked. So please forgive me if I keep looking down, because I want to make sure that everybody's questions are actually answered. Okay, so, actually, there was a question here from Margie as well, about is there a link between epilepsy and breath holding spells? Just before we go into the what to do, Children who have breath holding spells don't have epilepsy. Often what can happen is when they become unconscious, they may do some jerking of movements of limbs. They might look a little bit like a seizure, but no, it is different. That's why if it's the first time, I know it's terrifying, but if there is somebody else there with you, being able to video the episode so that your pediatrician or the hospital can see what has happened, and also really being able to tell the events before what happened so that your doctor is able to accurately diagnosing breath holding spells is really, really helpful. So the answer to that is no, kids with breath holding spells don't have epilepsy. So just be aware of that. Okay, so let's see, what else? Where do we get up to? That's right, we were talking about what to do. Now, the biggest thing is that, I know this sounds really, really hard, but keeping everything normal is what's important. Really, really, really important. Children should never, ever, ever be punished or disciplined if this happens. That's really, really important, okay? Really important. They didn't choose to hold their breath. Remember, this is involuntary. We need to remember that. Okay, so no interventions are needed apart from keeping your child safe. When they become unconscious, they will collapse to the floor, okay, or whatever it is they're on. You need to move objects away from them, making sure that they are safe where they are. That is actually really, really important. Okay? So making sure that we do that, making sure as well that we turn our child onto their side. Okay, this is helpful to keep their airway nice and clear. Don't put anything in their mouth, don't do anything like that. We just let them stay safe on their side and wait. Okay, so treat them normally after it happens. Really, really important. You treat them normally, they wake up, you get on with what you're doing, it's like nothing happened. This is really important because we don't want to punish or reward what they've done. Okay, that's important. So obviously, if it's the first one, you probably will have called an ambulance because you don't know that your child is having breath holding episodes. But if this is happening frequently, then please make an appointment, go and see your doctor, your GP or your pediatrician to discuss about what's happening. There are certain things you can do. It's trying to avoid triggers. It's looking at patterns in your child, what usually triggers this kind of episode. And another thing is that the literature certainly has shown that there is a link between iron deficiency anemia and the frequency of breath holding episodes. So that's an important thing you will probably want to discuss with your doctor if your child is having frequent breath holding spells, about getting their iron levels tested. That's something to discuss with their doctor, and then discussing whether or not they need supplementation. So that is an important thing. And I've got, certainly looking at my journal article that I've got here that is particularly talking about iron in iron deficiency. That'll see, I didn't staple the pages together. I should have done that. Now I can't find my iron page. That was really silly of me. Okay, so here we go. I found it. So what the study suggests is that an association between iron deficiency anemia and breath holding spells, and what it can do is the iron supplementation can decrease the frequency of the breath holding spells. Even in children, it says here that even with perhaps normal iron, if they're having really, really frequent spells, then it may be beneficial to have some iron supplementation. So what I want you to do is go and talk to your doctor or your pediatrician about that. So don't just go and start doing it yourself, okay? Make sure you go and talk to them and get their levels done first. And what I'll do is I will put the fact sheets and some of the literature in the comments below. Okay, so if on the odd reason your doctor hasn't heard of this before, then you can absolutely go and show them some of the evidence-based stuff down there. So I'll pop that in the comments below for you. It'd be interesting to have a read for yourself as well. Okay, so that's an important thing. So we know that children who are having breath holding spells, it's not harmful to them. Okay, they start breathing again on their own, they wake up again on their own, and that's important. Remember at the beginning I said that if your child has a complex medical condition that it can be different. I'm talking about simple breath holding spells here. It does them no harm and they wake up on their own. It is incredibly scary for parents and carers especially. I absolutely can understand that it would be terrifying. Neither of my girls do it, but we've got people who work for CPR Kids here who have been through it with their kids, and we've got that story in our blog actually from Erin, who's one of our educators, of her little girl who actually does that. So what's important here, they can be really, really stressing. So if this is happening frequently and you're finding that it is affecting your relationship with your child, that you are incredibly stressed, if your child is, having such frequent episodes, then getting your GP or your paediatrician to be able to refer you to a counsellor, somebody who can help with that side of it, is also incredibly important. Okay, that's really, really important, because kids still need to have boundaries. Kids who breath hold when they get told off or if they don't get their way, they still need to have those boundaries put in place so that behavioural issues don't happen later. So it's about finding that balance between the breath holding and the behavioural stuff, and that's when you need an expert to come in and help you. Okay, so don't be afraid to ask for a referral for that. Okay, so in summary, there are two types of breath holding spells. Cyanotic spells, which are blue spells, where your child will often have a trigger of anger or frustration, something like that, and they cry, they hold their breath, they turn blue and they become unconscious. This lasts often for a relatively brief period of time, hopefully resolves by itself within a couple of minutes. Okay. We can also have the pallid or pale spells, where it can often be triggered by something that your child may have injured themselves, or they're frightened of something, where their heart rate will slow down, they will become very, very pale, they will hold their breath and they will become unconscious. Some kids have both types. Both are not epilepsy, it is not a seizure. It is involuntary. Your child doesn't choose to hold their breath. Children who choose to hold their breath will start breathing again before they pass out. This is involuntary. It's an involuntary reflex. It can be linked to iron deficiency anemia, particularly with the frequency of them. So it's a good idea to chat with your pediatrician or your doctor about getting your child's iron levels tested, and they will decide whether your child actually needs supplementation. It's incredibly important to treat your child like nothing has happened, completely normally. And of course, if it is incredibly frequent, if this is placing a huge stressor on your family, please, you need to seek help about managing behaviour and stresses in your family from a counsellor or a child psychologist, and somebody for you to talk to as well. It's really, really important. Okay, so I hope that has been helpful. Do we have any questions? So I'm going to get the technology out now and see if we have any questions at all. Let me just get into this. Okay, here we go. Just refreshing the page to see if there is anything that's happening. It's just taking its time at the moment. Let's see. Okay. Almost there. Okay. Let's see. So at the moment, it doesn't appear like anybody has any questions at all. So next week, we are going to be talking to you about car sickness in children and what you can do. Now, Charlotte has actually asked a question. So Charlotte has asked, can breath holding be linked to silent reflux? Now, breath holding episodes that I'm talking about today, there hasn't been anything in the literature that I have been reading that has linked these kinds of breath holding episodes to silent reflux. Now, my understanding is that I think that the silent reflux side is something that we would need to get into in certainly another episode, but the breath holding episodes I'm talking about right now are more linked to that crying and so on. So I don't quite know the answer to this. I'm going to pop, I think this would be a really, really good question for your pediatrician, because I do know that some babies who are in a lot of pain with the silent reflux, and I had one child with silent reflux, which was awful, and she would do this when she was in pain and cry, but she never did that full breath holding to when they actually turn blue or pallid and become unconscious. So I think that there is a difference there. I'd love, if you are concerned about that, I would love for you to have a chat with your pediatrician about that. So thank you, Charlotte, for the question. Let's see, is there anything else at the moment? Just looking to see if you have any other questions. Okay, doesn't look like it at the moment, guys. We'll just refresh that one more time because I just don't want to miss any questions at all. That's just to make sure. No, I think we're good. So we'll be here same time next Thursday talking all about car sickness, because we have had a lot of people asking about car sickness in babies and toddlers and children. Okay, so hopefully we'll be able to answer some of your questions around that. I've got 2 terrible car sickness children, and I certainly have it as well, so it's a subject really close to my heart. Yep, the number of times we've ended up with a nice little vomit into a dog poo bag with no dog poo in it in the back of the car is quite frequent in my house. So I look forward to talking to you about that. I'll see you next week, everyone. Okay, bye-bye.